Hi, everyone. Thanks very much for joining me. My name is Michelle Moser, and today we're going to talk about hormone balance and healthy aging. Thanks again, and I hope you enjoy. So as a disclaimer, this is information meant to be just for informational purposes. I'll be talking a little bit about compounded medications, which are off-label use, and I'm not going to necessarily talk about things that are necessary for continuing education. So where do we start? Well, quite honestly, where we start is that this is all about cholesterol. Kind of funny, right? But cholesterol literally is the building block for every single hormone that is necessary for healthy aging. So if our cholesterol is too low, we're going to have a difficult time producing enough hormone to not only feel good, but to really help our body work. Because there are hormone receptors in just about every cell of the body, definitely in the gut, definitely around the skin, and certainly other places such as blood vessels, the heart, other organs, etc. Hormone imbalances, especially for women, can start in the teens or even 20s, and certainly as we age, those are going to change as well. Premenopause is something that can happen as early as in their 20s or 30s, especially again for women. Often birth control pills are prescribed to help with managing some of those symptoms that we associate with irregular menstrual cycles, heavy bleeding, mood disorder, things like that. But they're not always the best answer for everybody. Hormones really are not that complicated. It's not too hard to figure out, although the symptoms do tend to overlap. And that's where we're going to get into more of the specifics on how we discern what is actually attributed to one area of hormone imbalance or another. Really what we're talking about today and throughout most of my talks is basic physiology. We're talking about what happens in a human body early on in life, but also as we continue through our ages. It's really, please don't let anybody think that it's all in your head. It's really not. It's really in your gut, in your bones, vaginal tract, especially on your skin. Hormones change as we age. Of course, the hormones that that are elicited when we first start menarche for women, that's a little bit different surge than what we see a little bit later. Usually progesterone is one of the first hormones to decrease as we age, and that can give way to a wide variety of symptoms. But when we move through our years, through perimenopause and even to menopausal years, we're going to see even more changes in how that can happen. So when we look at physiologic changes in sleep patterns, and boy, when we're not sleeping well, that can really wreck a lot of things. Our incredible happy life can turn into something that's kind of dull and humdrum. But our inability to concentrate, to find our words, it's more than just walking into the kitchen and trying to remember why we actually got there. It's so much more than that. But there are many, many causes, and not everything is rooted in just genetics. It can be environmental issues. It can be the way we eat. It can be, do we drink enough water? It can be so many different things, but it doesn't have to be debilitating. It can be treated. And if we know what the true picture is, that's really going to help us to understand fully what the root issues are and to help specifically with that. So Dr. Pam Smith is one of my favorite persons that speaks very often on hormones, dysregulation, and changes. And she's got a newer book out on male hormones as well. But when we take a look at some of the prime issues that people bring to their provider, whether it's anxiety, depression, inability to sleep, even foggy thinking, all of those things can be rooted in a wide variety of hormones. So I highly suggest especially these 3 books. And what I really appreciate about what Dr. Smith does is she not only provides you with good concrete information, but it's all rooted in science. So about 50% of her book, maybe 40% of her book is all reference material. To me, that is perfect. It's a wonderful mix of everything that kind of comes together. There's many different reasons to consider hormone replacement therapy, and hormone replacement therapy can happen in the earlier ages, not necessarily waiting until perimenopause or menopause. But replacement therapy can help with symptoms. It can prevent memory loss. It can improve heart health, bone production, growth, and repair of a wide variety of tissues. There's a variety of hormones that actually regulate growth and repair, specifically insulin, growth hormone, testosterone, estrogen, and DHEA. And again, at least 3 of these begin with cholesterol. But most of the time, especially when providers are seeing patients, there's a wide variety of issues that are being brought to them. And it's really a laundry list of symptoms. And a lot of those symptoms are associated with menopause. But if we look at the individual and say, well, she's only 31, that can't be menopause. Well, can it? It can certainly be pre-symptoms, because this list only tends to get bigger and longer as we go through life and as we age. It's not like they all resolve just kind of miraculously once we hit another age group. Especially when we're dealing with issues like osteoporosis, which are usually not diagnosed until someone is in their 60s or 70s. We're doing a little bit more testing now, and even at earlier ages, but a lot of times insurance is not going to pick up that bill until that person's at least 50. But hair loss is something that we contend with all the time. Women are coming in, they're complaining about their hair thinning. They're not really sure why they're losing their scalp hair, but yet hair seems to be popping up elsewhere in their body that they're just not happy with. But those panic attacks and the anxiety and the dizziness, and even that correlates to weight gain, is just not very fun. That laundry list of symptoms is something that a woman will deal with a lot of times for decades without relief. So how do we actually discern what is a symptom associated with estrogen issues versus cortisol versus thyroid? It's really hard to tell by guessing. Of course, we can throw medications at that proverbial dartboard, but are they really going to stick? So if we do quite a bit of testing, we know ahead of time. Yes, testing can be a little expensive, and we have to keep that in mind when we're speaking to our patients about what exactly needs to be done. But if we go about this in a systematic manner, provide the information on all of the testing, then the patient is empowered to make choices for themselves as to what exactly they can do. All of the testing that I'm going to talk about is available to providers at any given time. A wide variety of pharmacies also do a lot of this testing, but there are some of this testing that is specific to providers only, and I'll go through those. Of course, serum testing tends to be the gold standard, although in my professional opinion, isn't necessarily the best way to look at some areas of concern. We can also look at blood spot testing, which is similar, but those are captured out of a capillary bed. Saliva testing is a wonderful way to really take a look, especially at cortisol and sex steroid hormones. It's a passive migration of hormone through the salivary pool, through the capillary beds. Urine testing will tell us what has already happened. So given the hormones that are in the body, what is the body doing to those, and how is the body changing that, and what is the end product? That really helps us to understand, are the metabolic pathways, especially through the liver, being clogged up through phase 1, phase 2, phase 3 of the metabolic processes, and what can we do to change that? So specifically when we're talking about the sex steroid hormone metabolism, what's happening through the 2-hydroxy pathway versus the 4-hydroxy or the 16-hydroxy? That's kind of what I call the good, the bad, and the ugly. 2-hydroxy is certainly much better than the 4 and much, much better than the 16-hydroxy, but we still have to keep all of that in mind. And there's a wide variety of cheek swab testing that can allow for really good understanding about hair loss specifically. Where in the hair production process is the hair function being disrupted so that that production can be changed with medications. We can have medications that can be specific to those phases, but also we can look at a wide variety of genetics testing. And that genetics testing is very easy. And again, that is specific to a wide variety of providers. That's certainly I'm not really talking about 23andMe or ancestry issues. It's really about understanding full-on genetics. And of course, there's stool testing as well to really understand what is going on in the gut. When we're looking at symptoms, they're very confusing to patients. And a lot of times they tend to lock into most hormone imbalance or wide variety of symptom lists being associated just with estrogen and a lack of estrogen. When in reality, if the progesterone isn't of optimal level, estrogen is not going to work very well either, because wherever there's an estrogen receptor, that progesterone receptor is right next to it. And without enough progesterone, that estrogen receptor is not going to be fully functional. So we really need to evaluate all of those. So is that symptom associated with estrogen dominance or estrogen deficiencies? Is it a progesterone deficiency? Because elevated estrogen can also suppress thyroid and absolutely have an impact on the gut biome. So let's really get into the sciencey stuff on all of this, and there will be a lot of reference materials provided today as well. Let's start with estrogen. It has over 400 functions in the body. 400, that's a lot, almost as much as magnesium. So let's look at the following. It can stimulate the production of choline acetyltransferase, an enzyme which prevents Alzheimer's disease. It increases metabolic rate, improves insulin sensitivity, regulates body temperature, prevents muscle damage, helps with maintaining good muscle, it improves sleep, decreases the risks of cataracts, maintains elasticity of the arteries, dilates small arteries, increases blood flow, inhibits platelet stickiness, which I think is really important, especially when we're dealing with menopause and the issues associated with stroke, decreases the accumulation of plaque in the arteries, enhances magnesium uptake and utilization, which can really help with muscle stiffness, because we all know that magnesium is a wonderful muscle relaxant. So if estrogen is not imbalanced, how is magnesium being utilized in the body? Maintains a good amount of collagen, especially in the skin. And when we're dealing with aging, that's the first place we look, right? It's like, what is going on with the skin? Is it being deflated, depleted? How are things changing? And we're always afraid of those silly little wrinkles. Maybe it's an estrogen issue. Estrogen can help decrease blood pressure. It decreases LDL and prevents its oxidation. It helps with memory, which brings me around to, I think the three main concerns of a woman is that she doesn't want to lose her memory. She doesn't want to lose her ability to move. And she really wants to age gracefully. That's really important. Estrogen helps with increased reasoning and new ideas, fine motor skills, helps maintain the water content in the skin, the production of nerve growth factor, and it has a positive effect on emotions. Estrogen actually increases HDL by 10 to 15%, decreases the risk of overall heart disease, in some studies showing up anywhere from 40 to 50%. It decreases lipoprotein A, acts as a natural calcium channel blocker to keep arteries open, enhances energy, improves mood, increases concentration, maintains bone density, and helps prevent glaucoma. Increases sexual interest, reduces homocysteine, decreases wrinkles, protects against macular degeneration, decreases risk of colon cancer, prevents tooth loss, and aids in the formation of neurotransmitters in the brain, such as serotonin, which decreases depression, irritability, anxiety, and pain sensitivity. Now, sometimes when we're looking at estrogen deficiency, we can correlate that in some situations to estrogen excess. Or is it progesterone deficiency? But what we do know about estrogen excess is it can actually cause a low functioning thyroid. Estrogen can suppress thyroid function. Too much estrogen and we become lethargic. We have uterine fibroids, excessive bleeding, a wide variety of gut bloating. Too much estrogen and we have a risk of breast cancer. We also have an increased risk of autoimmune disease, let alone poor sleep and headaches. None of that is very fun, but yet all of these symptoms tend to come in with a wide variety of women whenever we see them with their primary causes and issues. But what causes us to have too much estrogen in the body? Well, lack of exercise. Estrogen loves to sit in the fat. If we have a diet that's low in grains and fiber, a wide variety of environmental estrogens, and that can be anywhere from cash register receipt tape to using plastics on a daily basis. But taking too much estrogen. So are we actually testing to ensure that we may have given her a patch, but is it the right amount? Or is it all of a sudden too much for her? And that can change during the year or over time. Sometimes it's the impaired elimination of estrogen. For example, is she pooping every day? Our sex steroid hormones are eliminated in our fecal material. So if the thyroid is suppressed, too much estrogen, thyroid is suppressed, and there's some constipation, is that bowel actually, or small intestine actually recycling the amount of sex steroid hormone and therefore increasing the amount that is available throughout the entire body? And of course, elevation of 6-hydroxyestrone. And estrone E1, she is mostly implicated in a wide variety of cancers that are assimilated with hormone use. Estrogens have a dramatic impact on the brain. And what's interesting is that when I talk to people, they say, I just feel like I'm out of my mind. I'm not fully in my body. It's like my body is divorcing itself. I've lost the ability to spell simple words and be able to find my words. I'm always losing my keys. Is this early onset dementia or Alzheimer's? I don't know. But what I do know is that patients use these mild or general symptoms, but they're extremely concerned about what's happening to them now, but really how is now going to relate to what's happening in the future. Estrogen can increase the blood flow through the brain. It increases glucose and oxygen to the neurons. It protects neurons. It increases neurotransmitters, and it keeps the blood-brain barrier working. It increases sensitivity to nerve growth factor. It decreases neuronal generation of Alzheimer's beta amyloid plaques and peptides. It's a natural antioxidant, in the brain. It increases manual speed and dexterity, increases availability of acetylcholine, and it boosts 30% of the NMDA receptors to maintain strength, durability of synapses, especially those connected involving creating long-term memory. It decreases distractibility, and it turns on progesterone receptors, just like progesterone receptors will turn on estrogen receptors. Now, we've also talked a lot about, especially in the science and media, how much does estrogen really protect the heart? And for a while there, a wide variety of studies were kind of contradicting each other. So it was like, how do we really know? And whether we were looking at the Women's Health Initiative or the nurses study, the elite study, all of these really were very interesting. But when we take a look at how those studies were conducted and were able to hone in on the area that really connected the estrogen to the heart health area, that tract of the study, we see that when women are started on postmenopausal or menopausal hormone therapy within 5 to 10 years of menopause, which is a whole year without a menstrual cycle, it's fundamental to the success of estrogen cardioprotection in postmenopausal women without adverse effects. Because what's interesting is that so many heart-related issues, cardiovascular-related issues, and a wide variety of other chronic diagnoses tend to be made after a woman has stopped her menstrual cycle. So they are very closely related to hormone imbalance or dysregulation, dysfunction, perhaps. in menopausal years, whether we're talking about osteoporosis, osteopenia, whether we're talking about cardiovascular issues, high blood pressure, cholesterol issues, could be a wide variety of things, even autoimmune disease. Most of those diagnoses are made postmenopausally. This specific article was looking at coronary artery calcium scanning between 1998 and 2012 of postmenopausal women. And their finding was that hormone replacement therapy resulted in lower atherosclerosis and improved survival of all age groups and all level of coronary calcium. Very interesting. And this was actually, the information was actually provided in March 2017. We've also seen other studies reveal that cardiac estrogen is reduced in heart failure. We've also seen that with progesterone, that it does help to relax that muscle so that we can see better functioning and less irregular contracting. And this study suggests that estrogen replacement has a protective effect against the development of cataracts. So we have heard a lot about bilberry being helpful in decreasing the incidence of cataracts. And cataracts can happen very early in life. They tend to get worse with time. But this was put out, this Korean study was done in 2014 as it was published. And very interesting how they associated specifically estrogen and those and the decrease of development of cataracts. We also see that estrogen is related to diabetes, that postmenopausal women using low-dose combined estrogen replacement therapy have a decreased risk of developing diabetes and have better diabetic control. So this combined estrogen therapy was actually combined with a natural progesterone as well. And that, again, is because the cellular function is much more defined and is much more adequate. The mitochondria actually work better, but so does insulin reception. Estrogen deficiency has been suggested to be a state of accelerated aging. And that is, we primarily see that in the skin with the lack of elasticity, the pronunciation of fine lines, but also the kind of drooping effect of the skin, the lack of collagen and elastin. And in 2013, so 10 years ago, researchers estimated that over the past decade, so from 2003 to 2013, that anywhere from 18,600 to 91,600 postmenopausal women ages 50 to 59 years old had had a hysterectomy, may have died prematurely because they did not take estrogen. Now, it's a lot of times estrogen patches are placed on a woman within sometimes hours of her uterus being removed. But that doesn't necessarily correct the hormonal deficiency that was there, that it may be the root cause of why she needed a hysterectomy to begin with. And what we're finding more and more study is that if progesterone is one of the first hormones to drop off, that perhaps we need to focus more on progesterone and balancing that so that the estrogen receptors are working more efficiently. And perhaps we can avoid hysterectomy in the majority of individuals. Another study, which was a meta-analysis from 27 published studies, showed that a 28% reduction in mortality in postmenopausal women under the age of 60 that used hormone replacement, and participants had what they stated was an improved quality of life. And again, this was published in 2009. More information on low estrogen levels as women migrate through their lives is very poorly understood. However, women who end up having surgical menopause, that they could potentially have better quality of life. Now, there's a lot of women who just will not go anywhere near hormone therapy because their friends or their family members have had breast cancer. And what we're actually seeing in more published study is that perhaps cancer, especially breast cancer, is a lack of estrogen. which is very interesting. But there are ways to ensure that hormone balance is kept regulated throughout life so that we can perhaps avoid that situation altogether. What was found here in this study in 2020 is that the method of estrogen delivery is vital in assessing its benefits and uses. And that is primarily because when estrogens are given orally, we get a different result than if something is put through the skin. So when estrogens are given orally as estradiol or a biased or a synthetic estrogen, we see an increase in blood pressure, triglycerides, increase in estrone, which she can be a bad girl and she's primarily associated with cancer-causing issues. We see that estrogen given by mouth is related to gallstones because of how it's metabolized through the liver. It can elevate liver enzymes, and it can increase sex hormone binding globulin, which preferentially will bind testosterone. So if estrogen goes up and sex hormone binding globulin goes up, it's going to preferentially bind testosterone, which won't be active or available to a wide variety of tissues. And even if you then reroute estrogen and put it through the skin, sex hormone binding globulin may not come down. What we also know is that birth control pills have a significant impact on sex hormone binding globulin that may be irreversible. We know that estrogens given by mouth will decrease growth hormone, but it does increase prothrombic effects, CRP, and increases carbohydrate cravings, which isn't what women are looking for, right? Because they associate carbohydrate cravings with increased weight around the middle. Some studies have shown that compared to no therapy, that oral conjugated equine estrogen or oral estradiol was associated with excessive risk of venous thromboembolism. And in contrast, the use of topical or transdermal estradiol, which is most commonly given as a patch, was not associated with the same issues. Very interesting. When we're giving hormone replacement, if treatments can be individualized, we're always going to see a better outcome. We can always mix estradiol with a little bit of estriol. Estriol is the weakest of all the estrogens. It does have an affinity for vaginal tissue, so we can see better care of vaginal atrophy without overgrowing any other tissues. Unfortunately, estriol is the only estrogen that is not available commercially. It is only available in North America through a compounding pharmacy. But anytime we can individualize therapy, we're going to hone in on what's best for that individual. Even if we're looking at identical twins, we still need to individualize those therapies. They can still have very different effects. And we don't necessarily use estrone anymore. Once upon a time back in the 80s and 90s, we were using Triest, which was a combination of estrone, estradiol, and estriol. And that was usually in an 80-10-10 mix. So 80% was estriol and 10% was estradiol, and then the 10% was estrone. So now we're focusing more on kind of a 50-50 mix of 50% estriol or E3 and 50% estradiol, which is E2. So let's jump into progesterone. It's definitely one of the sex steroid hormones. It plays a role in menstruation, pregnancy, and the formulation of embryos. It's made in the ovaries and the corpus luteum, or the rind that surrounds the ovum, up until menopause. Once you stop ovulating, then you're not making much progesterone. After that, a small amount of progesterone is actually made in the adrenal glands. Progesterone is made from pregnenolone, which performs a wide variety of functions in the body. Pregnenolone is sourced from cholesterol. Progesterone has a lot of functions. Acts as a diuretic, it's anti-inflammatory, aids in ovulation, it balances estrogen, it has potentiation effects of GABA, It enhances thyroid hormone, has a positive effect on sleep. And that's why using oral progesterone can really help with insomnia, help somebody get to sleep at night, and perhaps even keep her asleep at those wee hours when some of us tend to go, whoop, wake up, and then we're thinking about 1,000 different things. Progesterone has a very active role in building bone, maintains good bladder function. It maintains a pregnancy. It helps prevent anxiety, irritability, and mood swings. It helps to restore proper cell oxygen levels, helps the body use and eliminate fats, increases metabolic rate, increases scalp hair. It induces the conversion of estrone to its inactive form of estrone sulfate. It lowers LDL. It modulates oxytocin receptors binding in the hypothalamus, and it promotes Th2 immunity. Protects breast health, relaxes smooth muscle in the gut to help with the breakdown of foods. It supports the immune system. It promotes the implantation of an egg, usually after it's fertilized, and it promotes the formation of myelin sheaths on nerves. When we look at this list of estrogen loss, there's quite a bit of overlap with estrogen loss, progesterone loss, and also estrogen excess. Anxiety, depression, irritability, mood swings, insomnia. A lot of that is what's very commonly seen on a laundry list of symptoms associated with almost every woman's visit to a provider. Nervousness, migraine headaches, weight gain, especially around the middle, decreased libido, excessive menstruation. Low progesterone can be caused by impaired production, perhaps PCOS, or just an impaired production of maturation of an ovum. Low luteinizing hormone. Increased prolactin production will actually cause low progesterone. Stress, wow. Especially in this last 3 years, right? Stress is just rampant. But anytime cortisol goes up, it'll actually bind to that progesterone receptor, which won't allow any progesterone to bind to that at any given time. So even if you have a lot of progesterone running around, the body still thinks it's low because something else is interacting with that receptor. Antidepressants, which is what is commonly prescribed for anxiety, depression, irritability, mood swings, but they in themselves will cause progesterone to be poorly produced. Excessive arginine consumption, and that can be someone who digs in the dirt, works outside quite a bit. There's a lot of arginine in a wide variety of materials. Sugar, oh boy. Sugar is the most highly addictive product anywhere in the world, but sugar will decrease sex hormone binding globulin issues, and sugar will change sex steroid hormone use. Increased saturated fats. Again, the standard American diet is so sad. Deficiencies in vitamins A, B6, C, and zinc. And B6 is really important because women burn up a wide variety of B6. We just utilize so much of it. But B6 is mandatory in moving tryptophan to serotonin to move from sleepy to happy. If we don't have enough B6, maybe our diet's not great. Maybe we're not taking good multivitamin. Perhaps we're taking those things, but we don't methylate appropriately. It could be a wide variety of issues. But even decreased thyroid hormone, and that's primarily not just T4, but T3, which is the active form of thyroid. But we can't forget about synthetic progesterone, which is actually a progestin. Progestin is medroxyprogesterone acetate, or Provera. It was developed in the late 60s, early 70s, really. Was produced by Upjohn to help protect the uterine lining from excessive use of equine estrogens, mainly Premarin. But progestins are available in intrauterine devices. Progestins are available in birth control pills, even the mini pill, but they do not reproduce the same activities that natural progesterone do. There's actually a black box warning on progestins that say not to be taken during the first few months of pregnancy because it actually can harm the fetus, whereas natural progesterone is absolutely mandatory in maintaining a healthy embryo and fetus. Side effects of progestins, the synthetics, increases appetite, increases weight gain, increases fluid production and retention, irritability, depression, headache, decreases energy, bloating, increases breast tenderness, decreases sexual interest. There goes that libido again. Increases acne, especially cystic acne. It increases hair loss, nausea. It can actually interfere with sleep patterns. Interferes with the body's own production of progesterone. So if you weren't making a lot to begin with, and that's only going to decrease, it does not help with estrogen balance because progestins do not bind to the same progesterone receptors. It remains in the body longer because of its metabolites through the liver, and it can cause spasm of the coronary arteries. Progestins increase breast cell replication and growth due to the stimulation of estrogen receptors, which is very interesting because we're trying to protect tissues. We really don't want them to overgrow. So are progestins related to breast cancer? Very interesting. And in the study that was produced in 2007, that was exactly what they found. And these are a couple more studies produced in 2005, as well as 2002. Estrogen progestin replacement therapy and breast cancer risk was put out in 2002 as a follow-up to the Women's Health International Study. And here's a few more reference materials. Other side effects of progestins: increases LDL, decreases HDL, protects only the uterus from cancer. When you add estrogen to a progestin, medroxyprogesterone acetate specifically, it does not confer cardiac protection and may increase the risk of cardiac heart disease among general healthy postmenopausal women, especially during the first year after initial hormone use. This treatment should not be prescribed for the prevention of cardiovascular disease. And that was a statement that was made all the way back in 2003 out of the New England Journal of Medicine. Natural progesterone effects not seen with progestins: estrogen balance. Natural progesterone leaves the body quickly. And that's one reason why serum tests are very difficult, because a lot of times when we draw blood, we're not going to see a lot of progesterone. Progesterone is primarily produced either first thing in the morning or late in the evening. And if somebody's using oral progesterone, especially to help them sleep, you're probably not going to see it much next morning. It does help improve sleep. It lowers blood pressure, but not to the point where you're going to bottom out. Lowers cholesterol. It enhances the activity of thyroid hormone. It improves libido. It increases scalp hair. It helps balance the fluids in and around cells so you don't have that peripheral edema, the swelling in the ankles. It is a natural diuretic. It's a natural antidepressant. It is anti-inflammatory. It helps produce immunity and promote immunity. It's neuroprotective, promoting myelination. Natural progesterone has shown to decrease the risk of developing breast cancer. Interesting. But we don't necessarily apply a topical progesterone to the breast tissues. In fact, I don't really believe that hormone therapy should be applied above the belly button anyway, because especially in testosterone, because testosterone is metabolized to estrogens, and you wouldn't want it to be applied in the upper body and then transfer through the lymphatic and deposit into the breast tissue. That could be That could be a little counterproductive. And this study looked at 80,000 postmenopausal women for 8 years using different kinds of hormone replacement therapy. It's very interesting. Studies have shown that progesterone does not induce estrogen-stimulated breast cell proliferation. A few more references so that you can check out my information. Prolonged use of progesterone without adequate estrogen can increase weight gain, can increase total cholesterol, decrease LDL, increase LDL, increase triglycerides, cause depression, fatigue, decreases libido, increases insulin resistance, and increased fat storage. So what this means is that it's important to test, see where people's hormones are, maybe even on an annual basis. And again, testing is not difficult. A lot of times it can be done in the privacy of a patient's home. But too much progesterone can elevate cortisol, which can then bind to the receptor. So there's a wide variety of things that can happen that are not necessarily positive. We need to go back to balance, making sure there's enough estrogen, enough progesterone, as testosterone, cortisol, DHEA, etc. Speaking of testosterone, it does increase sexual interest. It increases the sense of emotional well-being, muscle mass and strength, helps to maintain memory, helps skin from sagging, decreases excessive body fat, maintains bone strength, elevates norepinephrine in the brain. It's a tricyclic kind of effect, aids with pain control. Symptoms of testosterone loss, and testosterone is usually the second hormone that drops off perimenopausally. But if you don't have enough testosterone, it's hard to maintain muscle mass, so you have muscle wasting. You can have a lot of weight gain, especially between the waist and the knees, fatigue, low self-esteem, decreased HDL, dry, thin skin with poor elasticity, thinning and dry hair, droopy eyelids. That is very interesting. So people tend to have like a second eyelid or an eyelid that actually kind of comes down over and starts to rest on top of eyelashes. We actually use a testosterone cream that we compound, and we use a little bit on the Q-tip right above the eye, and it helps to build that elasticity and pull that second eyelid back up to where it needs to go. Helps with sagging cheeks, thin lips, anxiety, and memory's not as sharp when testosterone goes down. Testosterone may actually help with dry eye as well. Causes of low testosterone. So why would a woman have low testosterone? Well, menopause, because it's one of those hormones that drops off pretty early. Childbirth, chemotherapy, adrenal stress and burnout, endometriosis, depression, psychological trauma, birth control pills, and the HMG-CoA reductase inhibitors can definitely decrease testosterone. So when we're taking a look at your symptoms, how do we manage those? So I'm going to highlight some of the typical symptoms as to why women will go to the provider. Vaginal dryness. In the compounding pharmacy, we hear quite a bit from people. It's like, oh, it's just a little bit of dryness. It's really not that big a deal. But it's one of the symptoms associated with hormonal changes that can thin the walls of the vaginal vault. When the walls are thin, they can be weak, and they can allow the bladder to fall in or the rectum to collapse into the vaginal space. But we can actually use some types of estrogens to build that back up. Now, if someone has a risk of breast cancer or has had breast cancer in the past, we need to be a little bit more careful with that. But there are some non-hormonal products that we can use, such as oxytocin, sodium hyaluronate, and vitamin E. And we can actually combine a lot of these as well. But estradiol is a fairly strong hormone. It's fairly potent in the human body. It's commercially available in a vaginal product. But estriol, the third metabolite of the estrogen cascade, is a weaker estrogen, but it has a higher affinity for the vaginal vault. It is only available through a compounding pharmacy. It can be made in a wide variety of dosage forms. A pearl, which is a very small suppository, can be put into a cream or a gel or a mucoadhesive gel as well. Of course, personal lubricants can help with vaginal dryness. There's a wide variety of silicone-based products, and most of them have antibacterial properties as well. Because we all know too that the vaginal vault is dry and there's not enough lubrication. We certainly don't want women to be subjected to excessive bacterial application, and because everything is so close together there, and it can then climb into the urethra and lead to urinary tract infections. Mood swings. So I'm going to incorporate depression and irritability as well as anxiety into this. The mood swings are not all in our head. We absolutely deserve to be cared for. There are so many causes of mood swings. There's too many to count. Most of the time we're given an antidepressant, but do they really work? In some situations they do. Like venlafaxine might even help decrease hot flashes, but does it really help with depression? I don't know. Sometimes depression is actually rooted in the gut. It's hard to know. About 90% of our serotonin is made in the gut. So do we have a dysbiosis leading to lack of serotonin production? The gut is lined with a wide variety of receptors, especially estrogen receptors. So perhaps that's an issue. Now we can always test, because maybe elevated cortisol is actually causing the mood swings. And we can look at these hormones and actually see what specifically needs to be enhanced or even reduced. And then there's over-the-counter products. I recommend professional supplements, something that is affordable within a budget. Professional supplements are not necessarily more expensive, but L-theanine is a natural amino acid that calms different areas of the brain. They can be used with antidepressants, unlike GABA. So if you're using mood support that's over the counter, we need to be careful that you're not selecting one that contains GABA. GABA with an SSRI or an SNRI will interact. And most of the time people get really anxious and they feel like they're a cat hanging by their nails from the rooftops. It's really crazy, but it is counterproductive. Hot flashes and night sweats. You know, hot flashes and night sweats make women feel icky. They make you feel inadequate. They make you feel undeserving, certainly not sexy, not attractive at all. And yet oftentimes there's, oh, they'll just go away with time. Just hang with it. They'll go away with time. But sometimes hot flashes are due to excessive cortisol or changes in thyroid, not necessarily changes in estrogen, but even vitamin deficiencies. So we need to be very careful about evaluating what exactly is going on. And again, we can test for all of this. Certainly we can try hormones and that might be helpful, but we want to make sure that we aren't playing dart at the dartboard kind of medicine. We want to make sure that we can get it right at least soon, right? Maybe not the first time, but perhaps the second or third time, because we want confidence to be built with our providers. We want the patient to know that we have a wealth of knowledge and that we're willing to share that, and that we're on their side, that we're here to help them on their health journey. But perhaps we also need to focus in on diet. Is it high in sugars? And are those simple carbohydrates being taken in right before bed? What about alcohol? What about dehydration? Does the person need protein? All of these are very important questions that need to be answered before we just start throwing therapy at hot flashes and night sweats. A decreased libido is probably one of the most common issues that we hear in the pharmacy. Our desire to be intimate can change over years. A woman who has just had a baby has so much close contact with that baby that perhaps she doesn't need physical contact elsewhere. But when we look at the divorce rate, which is the highest between the ages of 35 and 50, those are the premenopausal years or the perimenopausal years, and even the andropausal years. So perhaps hormonally we've changed and we're not the person that our partner fell in love with back in the day. Perhaps our partner's not the person that we fell in love with back in the day. Physically, people can change. They've gained weight, they lose weight, their skin may change. Even their moods and how they relate. And that can also contains some of the symptoms associated with communication. Women tend to be much more affected by this than men, but it can be fixed. People, especially women, can be much more amorous with hormone balance. We can't forget oxytocin. That's our connection or our cuddle hormone. And we make a lot of oxytocin when we hug. But women will produce more oxytocin when they hug another woman, primarily because when a woman hugs a man, there's no premeditated underlying issue there. We make a lot of oxytocin when we play with puppies and pet kittens and things like that. And there's some herbal supplements that can help with libido as well. Is there a one-size-fits-all fix? No. But we can help people navigate that pathway. Tummy bulges. Wow. I see so much of this on social media as well as on TV. It's like, want to get rid of that, what do they call it? The menopausal apron. Well, it's not as easy as just taking a pill. Well, it might be for you, but for most people, it's not. And even if they eat right and they exercise every day, still doesn't come off. So what are the root issues? Well, was it stress? You know, when cortisol goes up, we become insulin resistant. Our metabolic issues tend to change. Are we then going for more carbohydrates because our cells think we're starving for sugar? Are we using alcohol to mask all of this? What do we use for treatments? Well, there's a wide variety of medications that are commercially available, but also compounded that can help with weight issues. We use low-dose naltrexone. Naltrexone is one of the components of Contrave, which is commercially available. We can compound it so that we can hone in on the best dose specifically for that individual. Can't forget thyroid. You know, thyroid is the master metabolic gland. It controls everything. Every single cell in the body has not only a thyroid receptor, but a cortisol receptor. Cortisol can impact thyroid. Now, this picture is actually from, I believe it's 1913, of a woman who has a lot of mucin production. She's missing the outer third of her brow. She's very full in the neck. Her hair lacks luster. She's kind of full in her hands and her fingers. And really, she has a thyroid disorder. She is not managed as well. And there's an after picture of her 4 months later after starting thyroid therapy. And back then we only had desiccated thyroid. She actually looks so much brighter and healthier. She doesn't have that puffiness around the eyes. She has more definition in her cheekbones, and her nose is not as broad and flat. She also has less wrinkling hair here on the forehead, and she has more luster to her hairs and less puffiness in her fingers. We can always look at levothyroxine. That's the most commercially available, commonly prescribed product, but it's still inactive thyroid. And we're assuming the patient is going to convert levothyroxine to liothyronine, T3, which is active on the cell wall. Well, we're making a big assumption there, big assumption, because that enzymatic process of plucking off an iodine to move from T4 to T3 is calcium driven. So if somebody has mismanaged thyroid issues for decades, that's going to lead us down an osteopenia and osteoporotic pathway. We can still use desiccated porcine thyroid, commonly known as armor thyroid. Nature Thyroid is no longer available, by the way. They've removed that from the market. All of this can be compounded as well so that we can hone in on the very specific doses needed for that individual. whether somebody needs chromium, selenium, vitamin D, zinc, even iron, because ferritin plays an enormous role with balancing thyroid. We got to make sure that, again, everything is in balance. Stress. Who has stress? I don't know. Low energy, weight gain around the middle, and that's due to metabolic issues and insulin resistance, binge eating, cravings, increased blood pressure, increased aches and pains, increased cholesterol, impacts or actually suppresses thyroid function, increases triglycerides. Some people even get kind of hoarse when they speak, increases blood sugar levels, increases night sweats, increases in inflammation, and all of this can disturb sleep. Again, doesn't it sound familiar? A lot of patients come in talking about this. It's the number one killer in all people in the US. We're all stressed. 2020, 2021, and even 22 is definitely 3 years for the books. It leads to increased weight gain, especially around the middle. And that's because of where the pancreas is located in the abdomen. It can actually deteriorate brain matter. Cortisol can break down bone. It increases cravings. Anytime you increase cravings and you increase blood sugar levels, that's going to break down bone as well. It can also increase blood sugar levels associated with high blood pressure. It's going to be really wreak havoc on the gut, which is going to cause vitamin imbalances because nothing's being absorbed appropriately. So where do we start? We start by breathing deep breaths, especially women. We tend to be kind of shallow breathers. Drink enough water, mild exercise. This is not about running a marathon. We got to make sure that we are moving every day. We've got to be able to move, but also to be able to calm ourselves. We need to learn to pray and meditate. And I mean, really learn. It's not easy shutting off that brain that is going 100 miles an hour. Then we can test. We can test at any time, but we can also make sure that we can get all of those hormones under control. When we're looking at testing, there's a lot of different ways to test. If we want to look at how is a body genetically made up, there's a wonderful cheek swab test. It's called 3x4 genetics. And there's a wide variety of providers out there that are specialized in understanding and making recommendations based on the outcomes of the 3x4 genetics test. It's a very in-depth test result. It looks at 36 core elements, and then you can make changes. Those elements will determine how well does somebody metabolize caffeine, metabolize salt. What kind of exercise should they be performing? Are they an endurance runner? Should they be doing more yoga or Pilates? But really, what is the condition of overall organ health, brain health, bone health? What's going on with their hormone status? And all of those are very, very important. But it will also look at genetic SNPs on how well we metabolize our vitamins. Do we methylate appropriately? Do we sulfate appropriately? And that all goes back to any kind of medications need to be prescribed accordingly. Because if you are genetically predisposed to not assimilating medications used for cholesterol, then perhaps they shouldn't be prescribed, and we need to look at other areas. Very important stuff. Thyroid testing. We only look at this in the blood or blood spot. And through a blood spot, we really can look at the complete thyroid panel, which is more than just TSH. We can look at free T4, free T3, and the thyroid peroxidase antibody. In whole blood, we'll look at the thyroglobulin antibody as well as reverse T3. Now, why are the two antibodies in reverse T3 important? Well, the two antibodies will show us, is there an autoimmune issue? Nobody is 100% Graves, 100% Hashimoto. They're usually a little bit of a mixture of all of the above there. And a lot of times people are on a kind of a roller coaster ride with their thyroid balance. Thyroid issues affect women more than men. It is carried on the X chromosome. So it's not uncommon that we see grandmas, moms, children, women, girl children that are affected by this. Now, a woman can give it to her son, but her son usually is not going to pass it down. So there are some thyroid issues that we need to pay attention to. And if we do have positive antibodies, what can we do to treat those? It is very important to treat because those antibodies can affect other organ systems. They are not selective just to thyroid function. And we can use low-dose naltrexone for that. When we look at vitamin D, we look at that primarily in the blood, or blood spot. Normal is 30 to 100, but optimal is over 70. In fact, we can even decrease cancer risk if we keep our blood level of vitamin D over 70. Hormones can be looked at in blood, urine, and saliva. Saliva is really a passive migration of the hormones through the capillary system, and it shows us what's really happening within the cell. In the urine, it takes a look at what the body has already changed and metabolized, and it's basically throwing away, but it's also very helpful. And in the blood, it is a quick view, but again, hormones are oils and our blood is a water system. So it doesn't really show us a lot at that given time. Saliva, again, is a water system, but because it is a passive migration, it is more clearly representative of the cellular level of hormones. When we look at cortisol, it's very easy to look at that in saliva. And if we do a 4-point cortisol test throughout the day, we can really see where the peaks and valleys are. And do we need to correct those so that we can be higher in the morning and then slowly, gradually decrease that amount of cortisol throughout the day so that we can get to sleep and stay asleep? We can always combine a lot of these tests as well, and in very handy, easy to use at-home kits. Providers can use a variety of labs. This is just one example. They can become providers with that lab. You can have them at your clinic, or you can send them to a pharmacy that can stock those as well. It's really up to you. When we're looking at gut testing, now this is a stool evaluation because the gut really is our second brain. It is the second highest density of enteric neurons in the entire body, second to the brain. Even small bursts of stress during the day can significantly impact the microbiota, and not just initially, but really over time. It can literally change where the good guys are not necessarily there, the good bacteria. It can allow the bad bacteria to grow, which can then increase inflammation. Oral health has been very positively linked to cardiac risk. And if the gut biome is not well substantiated with essential good bacterium, a lot of times the oral health or the oral bacteria can then transverse to the gut. It's been scientifically proven that specific bacterium, virus, fungus, and parasites in the gut can not only lead to ulcers, but also dermatology issues, immunity issues closely associated with autoimmunity, and even cancer. And we're seeing that a lot with even more vaccines coming out to target cancer, and that's because they are antiviral vaccines. When we do a Biome FX gut test, we're doing a complete DNA sequencing of everything that's in the gut. We know exactly what's going on. And then we can enhance what's low and then decrease what's excessive. So it's not just about grabbing a probiotic off a shelf, but perhaps we need to take care of H. pylori. Maybe there's bad bacteria in there that we can target. Maybe somebody's been on antibiotic therapy for quite some time, maybe even for H. pylori, and we need to replete or enhance what needs to be restored. We can identify the good, the bad, and the ugly and make for a much healthier individual. A lot of times when we correct what's going on in the gut, we can see weight loss, we can see improved mood, much more energy, and less aches and pains. It's really, really fascinating. There's a gut restoration process that takes about 3 months to complete, that has 3 months of spore technology probiotic, 2 months of prebiotic, and 1 month of mega mucosa, which helps to repair the lining. of the gut, which is literally only 1 cell thick. What can you do right now to help you? You can spend 10 minutes in the sun. Well, if we have the sun out there, a lot of us have a little bit of sun. Go out first thing in the morning, and that means before 10 a.m. Perhaps even lift your shirt so that your tummy is exposed, so that your liver can pull in any of that natural sunlight. That gives for better digestion, better brain function, happier mood, better hormone balance. We can decrease white fat accumulation through simple carbohydrates, a little bit of exercise. We can also use certain sound waves to decrease anxiety. Yoga. There is some yin yoga, and you can look that up on YouTube, especially for those individuals who are kind of anxious and they really can't sit still very well. But go outside and put your bare feet in the ground. Anytime that you're grounding, you're actually going to allow for changes of energy, and that grounding will help to decrease stress throughout the entire body. There's a wide variety of commercial products that are available to help with hormone balance, depression, anxiety, but one size doesn't fit all. Compounded therapies can be kind of those missing links to establish what is necessary for that individual at that given time. We can use a wide variety of hormones, estriol and estradiol, in creams, troches. Those are little bits that are dissolved under the tongue, or even drops that are applied on the skin or dissolved under the tongue. Progesterone, we can use in an oral capsule, cream, troche, or a drop. Testosterone is usually applied in a topical or transdermal cream, troche, or a sublingual drop. And oxytocin is almost always a nasal spray. It is very sensitive to heat. We have to heat up a troche base, so it usually kills off oxytocin, but we can use it in a vaginal gel as well. There's a variety of vaginal treatment options. This is a picture of the vaginal pearls that we make. They're very tiny suppositories, very easy to insert, but yet we can also use a little bit larger suppository, different creams, gels, and even those gels and creams that are muco-adhering. So you can use less medication and it will stick around longer, less mess. There's some over-the-counter herbal products that are very easily used. Evening primrose oil, black cohosh, chasteberry, which is also called Vitex, help to regulate that hormone cycle. DHEA, usually it can be taken orally, but can be compounded in a topical cream as well. DIM or IC3, indole 3-carbinol, those are estrogen metabolizers, so help to get rid of excess estrogen in the body. And there's a variety of libido enhancers. But what about low-dose naltrexone? You know, it's one of those things that we don't really hear a lot about. It's commercially available in a huge tablet, 50 to 100 milligrams, but we can actually use it in very tiny doses. And we use that because in small doses, it works completely different than in larger doses. It helps to modulate the immune system. It will intermittently block pain receptors, the same ones that pain medications do. It reduces the pro-inflammatory cytokines. We've heard a lot lately about interleukin 6 and 12. Those are the pro-inflammatory cytokines that are associated with COVID virus. But naltrexone can also help normalize thyroid function, and it helps support hormone function. And there have been over 900 scientific articles and case studies written on low-dose naltrexone in the last 30 years or so. We are here as a pharmacy and a pharmacy team to support you. We don't ask patients to change with their doctors. We want to work specifically with the providers that they've established relationships with. We can help you with testing. We can help you evaluate those tests. We can help with dietary issues and other nutritional factors that are difficult to discern and to get through within an hour or so, or even a few minutes that a provider is having with that patient. And really, the bottom line is that good therapy is always the best way. I wanted to let you know that hormone therapy is at risk. The FDA is trying to take away our hormone rights and our access to that to these compounded medications, which have literally impacted millions and millions of people very positively. What we're asking you to do is to share your experience with your US reps and your senators, because the risk to compounded hormone therapy is absolutely real. And if they're going to go after this, what are they going to go after next? So please go to compounding.com and submit your testimonial. This is the network of pharmacies that we are connected to. All of these pharmacies are well equipped to help answer your questions and to help you with your specific needs with your patients and other providers. And certainly if there's anything that I can do to help you, this is how you can contact me. This is my personal cell. This is my personal email. You can also find us on social media, and we're more than happy to help at any given time. Thanks so very much for joining us. We hope you'll join us on our next recording. Take care.